Hi everyone, welcome to Innovations in Education. Currently, I am a registered nurse on 8 Lyme, the oncology unit of Lancaster General Hospital. Patients of 8 Lyme receive oncology education prior to and while receiving chemotherapy treatments. This education typically focuses on the diagnosis and the treatment. There was an informal survey conducted of the patients, wondering if the patients were receiving the education that they felt they needed. The results were similar of those noted in an article, as well as a study that was conducted. There was a lack of education noted in sexual health, fertility preservation, support groups, and how to ask for financial help. Why are patients not getting the education they need? So what are the barriers? It was noted that it's often a lack of knowledge, personal discomfort, inadequate time, concern about invading patients' privacy, also religious, cultural, or ethical beliefs. There was also noted that there was a big focus placed on the physical aspect of the illness and the treatment, often leaving out other information. I found that to be big on our floor. We were focusing so much on the disease itself, the disease progression, what could happen, that we were leaving out smaller information, which is very important to the patient, the support group, the financial need. All of that was something that was often getting forgotten about. I chose to focus this paper and presentation on the lack of knowledge. Some of the other things we can't really fix. The inadequate time. We still are going to continue to have the same amount of patients we have, so we're not going to be able to have this time all of a sudden. But I think that if we can increase the knowledge of the clinician, we would therefore be able to better increase the knowledge of the patient and have overall satisfaction for both clinician and patient. So currently, right now, when a patient is admitted to 8 Lyme, we do a learning assessment on them, basically asking them how they best learn. We don't really do too much other than that, and I feel as a profession we can do better. Not just for 8 Lyme, just all nurses, anyone working with the patients actually. So in order to better care for the patients, we must first educate the clinicians who care for them. While in nursing school, there is the use of simulation learning, and there also needs to be taught how to embrace and how to learn from evidence-based practice. Once they are on the floor with the patients, currently the nurses are using TeachBack and also implementing those evidence-based practices that we had learned about in nursing school. So innovations for nursing students. This is an example of a simulation lab. Simulation is a form of learning through experience. It is an educational strategy to allow students to participate in a real-life application of theories put into practice. Simulation provides a safe learning environment without fear of mistakes. It is often used to teach specific content, to teach decision-making in clinical scenarios, to teach competencies within collaborative practice. It was shown for students who used simulation within their education had a positive effect on their perceptions of autonomy and relatedness. The same students were noted to have more motivation, they were more competent, and felt more connected to the class. A goal of simulation was also to provide opportunities for clinicians to practice and enhance team-based skills, to be able to work in that team environment. If we cannot complete that education for lack of time, for example, when you have your team there, you can often ask the doctor if they have time, or the palliative care team, or there's other members of the team. So if you're able to speak with them in nursing school, you're better equipped to deal with them when you're on the floor. Also, for evidence-based practice. It is imperative for our nurses to have the ability to seek out this new emerging evidence, to identify the new technological advances and therapeutic agents, all while being able to appraise and apply this information to their clinical practice. It is the role of the Educational Institute to build these capabilities within the students. Once they are nurses, they are going to be expected to be able to use this, so if it's incorporated into their learning, it's just something that is, not just something new. Innovations for registered nurses. Currently, we are using TeachBack, and we're hoping that that will help increase patient satisfaction and also their knowledge base. TeachBack is a method of educating patients in a manner that a patient can understand. Patient understanding is verified when the patient is able to state the information given to them in their own words. The main goal is to provide effective teaching at a literacy level the patient is comfortable with. Teachback minimizes the risk of patients misunderstanding critical information in the clinical setting. The Teachback method promotes healthcare literacy, which will further promote healthier patients and are able to more fully participate in their own care. The use of evidence-based practice in the clinical setting. Evidence-based practice in nursing is the most consistent clinical use of the strongest, most up-to-date evidence from well-formulated studies and guidelines to improve the quality of patient care and patient outcomes. In order to implement evidence-based practice, there needs to have a successful integration of sound research findings and clinical practice guidelines, along with clinician expertise and patient values and preferences. Evidence-based practice has been implemented because of the great outcomes. This model has shown measurable improvements in the quality of patient care, the consistency of patient care, overall patient outcomes, and healthcare containment. So in conclusion, the newest and best in education is not always a new piece of technology. In current nursing practice, the most innovative ways to reach the patient relies on ensuring a sound education for the clinician so that they may better educate the patient. Through the use of simulation and knowledge of how to seek out the emerging best practices allows the student nurse to cultivate a love of education. This love of education should continue once a nurse becomes certified. The use of Teachback and the use of evidence-based practice allows for the better education of the patient and should increase the overall satisfaction of the patient. Thank you everybody for listening.